infrastructure development in its health sector, backed up with medical facilities, Delta State believes it's on the mission to becoming a hub of what it calls medical tourism as part of efforts towards achieving a Delta beyond oil. I'm Onyi Sunday, and this is Delta Beyond Oil. Delta State's vision for developing the health sector is aligned to the International Millennium Development Goals, aimed at reducing child mortality, improving maternal health, and combating HIV and AIDS, malaria, and other diseases. The government's efforts have been targeted at three key pillars: infrastructure, the latest in healthcare technology, and the recruitment of the best personnel, from researchers to surgeons. 12 to 15% of the state's budget is committed to the health sector. Delta State has over 450 primary healthcare centers, 65 general hospitals, and about 6 central hospitals. These are all spread across 25 local government areas.
Basically, the primary healthcare centers, we have been building most of them. Over 60% of this has been built by the state government, particularly under Dr. Emmanuel Eweta Odoa. The equipping, the furnishing has also been done by this government. But the running of the hospital as it is now, of the primary healthcare center, is at the hands of the local government council. A lot is happening there. Within a radius of 5 kilometers, you must come across one health center. They are evenly spread across the state. But the one that concerns us as a primary, the secondary centers, are the government hospital, the central hospital, and the general hospital, and the tertiary hospital, which is the teaching hospital in Ogara.
These facilities also cater for patients from outside the state, and as fully equipped hospitals spring up across Delta, staffing them is a critical element. So the government has been investing in teaching institutions. Recently completed Delta State Teaching Hospital Ogara, a tertiary learning facility, was established to address this. Various clinical departments here have been accredited for postgraduate training of doctors. They include family medicine, anesthesia, surgery, pediatrics, internal medicine, and obstetrics and gynecology. Some of the state-of-the-art facilities and equipment include a 1.5 Tesla magnetic resonance imaging machine and a 64-slide CT scan. It caters to patients from far and wide who need specialist treatment.
What we are doing in Delta State for medical tourism is to pick some subspecialties in these areas. For example, in pediatrics, we find that we have equipment and expertise in neonatology because of the peculiar issues of pediatrics in Delta State. Also because we have a maternal and child under 5 program that leaves the neonates unprotected. And in internal medicine, we have some areas of, for example, neurology, which we focus on. Also in surgery, especially in surgery, minimally invasive surgery, endoscopy, urology, orthopedics, and most recently neurosurgery. Neurosurgery, in particular spine surgery, which is one of the areas, one of the problems that leads most people outside the country, especially to India for surgical treatment. We've recently started developing a program in neuroscience.
A tour of the impressive hospital brings its vision of being a hub for medical tourism to life. From its patient treatment ethos to the facilities it boasts, the hospital in Ogara aims to be the best. The hospital has high technology theaters, consulting rooms, and a 6-bed intensive care unit. It also specializes in neonatal intensive care.
Actually, this is Theater 1. Usually this theater is for mainly clean cases, not dirty cases. And this is the operating table. And we have our operating lights. They are all electronically controlled. And this is the anesthetic machine that is used to put patients to sleep and monitor patients during surgeries. And we have camera here too. During surgery, if the camera is switched on, that screen there, whatever is being done on this table, will be showing on that screen for teaching purposes. Because we have a number of students that are allowed at a particular time into the main theater. So the remaining students, they will be in the other room there. This camera will be put there. So they can be watching the surgery while surgery is going on. Clean theater too. Eye surgeries are done here. And also minimal invasive surgeries, minimal access surgeries. Yeah. This machine is called a stack system. They use it for endoscopy. They pass a scope into the patient to see what is inside. It will show on the screen there. And if they want to do surgeries that they don't want to, the surgeon does not want to use knife.
Emergency and trauma cases are also catered for here. These oxygen pipes draw on a supply from the central oxygen room, which also has backup tanks. Accident cases can be treated here at a faster pace because doctors have all the diagnostic equipment on hand, like these monitors which check on patients' vitals. This unit alleviates bottlenecks traditionally associated with general or teaching hospitals in Nigeria. It uses time-saving digital technology, especially in the X-ray unit.
The X-ray room, this is mainly used for plain X-ray images. Now, obviously, images are acquired in an analog format, and it's processed to a processor over there, which is called a CR reader, and it sends images into a digital format and sends to PACS. PACS is a picture archiving communication system. It's a system whereby images are acquired digitally and can be seen around the whole hospital in a matter of seconds.
Surgeries performed at the hospital range from eye surgeries to cesarean sections. Smaller diagnostic procedures are also done. The prevalence of kidney disease is high in Nigeria. Research done by the Association of Nephrology puts the figure at 36.8 million Nigerians. That's 23% of the population. Despite the severity of the disease, patients are faced with many challenges in terms of treatment. About 15,000 new patients are diagnosed every year. Because of the lack of dialysis machines throughout the country, many are forced to seek medical attention outside the country. Hospitals in Delta State plan to fill that gap, offering renal treatment centers. There are even plans to carry out the first kidney transplant in November this year.
Kidney transplantation being the ultimate treatment, ultimate renal replacement treatment. But issue with kidney transplantation is bigger than kidney transplantation. We're developing a kidney diseases center which deals with the whole range of impaired kidney function, from dialysis to vascular access to transplantation. We've set a tentative date for the first transplant, which is sometime in the middle of November of 2013. At the moment, we are training people overseas to participate in the transplant, and we'll continue with this program for 5 years. We have signed an MOU with University of Texas Southwestern. So we'll do this together with them for 5 years and establish this program over this period. But we hope to do the first one in the middle of November of 2013.
The Echo Baptist Hospital was taken over by Delta State government at the end of 2009. The hospital, which also has a nursing school, is being renovated and repositioned as a specialized quality healthcare center.
This project is about raising this hospital to another level. You know, when I came in 2010, this hospital was in a state of disrepair. In fact, everybody knows what Echo Baptist Hospital is all about. It has a name that is known far and wide. You know, but unfortunately, over the years, because of certain problems between the community and the original owners of the hospital came down to, I don't know how to describe it, but when we came in, you can describe this hospital as just a mere health center. Things were not in order. So the government thought it wise to raise things to a higher level. That is exactly what we are saying now. When I came in, yes, the structures were available, but they were really dilapidated. So the government decided that the hospital should wear a new look, and the new look is what you see here today.
Even with the ongoing restructuring, some departments are already up and running. A case in point is the dental clinic, which is already taking care of patients' needs.
Basically, we do routine dental treatments like scaling and polishing, tooth fillings such as amalgam and composite fillings. We do tooth extraction. We can do partial dentures and full dentures, and we can also do what we call intramaxillary fixations, like when somebody has road traffic accident where there's an injury to the jaws or fracture to the jaws, both the maxilla and the mandible. We can also fix it here. But for most of our treatments, we don't charge more than 2,000, 2,500. We don't charge more than that for our treatments because we understand the terrain of the people around here, so they don't charge much.
The overhaul of the state health sector is reflected here at the Asaba Central Hospital. Located in the state's capital, it is meant to serve as the headquarters of medical facilities, but it's still far off from what it's envisioned. The facility is undergoing an aggressive architectural correction.
Actually, what we meant on ground when we came here in January, when we start work on January, start work on the building in January, it's the building, most of the finishing on the building, they are very bad. The plastering, the design of each of the building, like the theater, the one we took you around to see, the theater is very bad. The admin also, if you see the finishing on the admin too, it's nothing to write home about. Like the theater now, we've taken the remodeling, we change the design of the main theater so that at least we can have the red line. None of them was in the former design. Like autoclave room, scrub room, we don't have it in the theater, but now we have to remodel the theater and include all those things.
While every local government headquarter has a general hospital, a number of other primary healthcare centers cater for the needs of rural communities. Several of these are also being constructed across the state and are at various levels of completion. A key project is the completion of the maternal and childcare hospital in Warri. The hospital was built to accommodate the increasing number of expectant mothers who are entitled to the free maternal care while in the state.
This hospital takes in about 400 deliveries a month, giving us over 4,000 deliveries per annum. Now, this began with the free maternal services. Before the free maternal services, we were picking about 2,000 deliveries per annum. But because of the increase significantly of antenatal attendance, we had an increase in the delivery rate in the facility. Of course, with the increase in delivery rate in the facility, we had a situation where services needed to be expanded. So we made representation to the government on the need to expand services. Why? Because we found that our antenatal services, our antenatal attendance had increased significantly because of the free maternal services. Of course, you are aware, obstetricians and gynecologists have constantly argued that removing user fee for antenatal care will increase uptake in terms of the number of visits. And of course, this played out completely in the Delta State program, where the number of antenatal visits increased significantly in comparison to what it was before the free maternal services was initiated.
More medical personnel are needed across the state, 65 hospitals and over 450 primary healthcare centers. There are 300 vacancies for doctors. As an incentive to attract them, government has constructed staff quarters in hospitals which previously had none, more especially in the rural areas where communities need access to doctors and medical care. The Nigerian health sector is no stranger to industrial actions. To avert strike actions and disruptions to patients' care, a minimum wage agreement has been put in place, so doctors will be paid accordingly. Another problem facing hospitals are erratic power supplies. To prevent surgeries being compromised by power outages, the government has provided generators to theatres, maternity wards and laboratories at all government hospitals. There are also dedicated lines from the Power Holding Company of Nigeria directly to some hospitals. When Delta Beyond Oil returns, we take a look at steps taken by the state government to ensure development in the health sector has a direct bearing on its people beyond the mere provision of physical infrastructure.